Welcome to Medical Minutes here on DMG TV2. Today we are going to be talking about sports medicine, specifically concussions, with Dr. Jim Goff. And then we're going to talk about hip replacements and what you need to know about that with Dr. Wilbur Gett. They are both from the East Ohio Orthopedic Center. Then we come over to Union Hospital, where we talk to emergency room doctor, Dr. Nate Johnson, as well as from the Tuscarawas County Health Department, Andrea Dominic. She is the director of the Alcohol and Addiction Center. We talk about drug overdoses and addictions and what we can do about it here in Tuscarawas County. All coming up on Medical Minutes.
Hi, I'm Elaine Miller with Naturally Green Cleaning Service. My company serves both commercial and residential clients. We do general cleaning, spring and fall, empty homes to get them move-in ready, and final cleans for new construction. We use eco-friendly cleaning products that leave your home or office fresh, clean, and safe for you, your family, pets, or coworkers. Our focus at Naturally Green is to provide excellent customer service paired with outstanding work to build a relationship of trust with you, our clients. Having served the area 4+ years, we have had many referrals and testimonials that you can access on our website at www.naturallygreencs.com. Our work sells itself, therefore we have never had any contracts even with our largest commercial accounts. Call us today for your free quote and see what makes our company stand out.
WJER and TV2 would like to introduce you to a new website, WJERTV2.com, where you can watch exciting high school football, soccer, and volleyball replays from TV2 Sports on your home computer, smartphone, or tablet. Also watch the latest episodes of TV2's original programming, Sports Talk, The Garden Girl, The Not So Shy Chef, Off the Record, and Medical Minutes, as well as catch up on local community news and search for local businesses. So make sure to check out the new WJERTV2.com community website where everything's local.
Welcome to Medical Minutes here on DMG TV2, Time Warner Cable. I'm Jennifer Clark, and with us today is Dr. Jim Goff. He is with East Ohio Orthopedics here in Dover, and you're a sports medicine specialist?
Correct, yes.
And what is that?
I'm a primary care sports med doc. I was trained in family practice, and then I went off to do a sports medicine fellowship at Ohio State. And basically through that fellowship, we learn how to take care of musculoskeletal injuries that occur, whether it's an athlete or a weekend warrior, runners, football players, you name it, from peewee all the way up to our elderly active that we take care of. So not only everyone thinks sports medicine, well, I'm not on a team, I can't come to that doctor, but yeah, we can see a lot of 50-year-olds that run, that lift weights, that play sports. A lot of people that see arthritic changes too in their knees when they're playing activities, running, jumping, even walking the dog. So sports medicine is a whole gamut that covers active people. And so that's what we train in that first year. Not only do we take care of musculoskeletal injuries like knees, backs, shoulders, but we also take care of medical conditions like mono, concussions, skin conditions in wrestlers, impetigo, things like that, MRSA, things that we see in the athlete. So not only is it from a musculoskeletal standpoint, but we also treat the medical side of an athlete.
Now, what got you interested in sports medicine?
Just growing up around the area. I grew up in Stark County, played a lot of football up there.
Okay, for who?
Maslin, so
we'll let that slide.
Yeah, we'll let that go. But I grew up in this area. I take care of Maslin, Washington. I take care of Fairless Falcons, but I help out with the schools down here, with New Philly, with Dover, Garaway, Indian Valley, Claymont, and Tusky Valley. So we have a lot of schools that we take care of. I see athletes from all those schools, and I'm just new down here, so I'm getting ready to take care of them as best as I can.
Now, you played football, but there's so many other sports. What are some of the most common injuries?
Most common injuries, right now, September, we've got a lot of runners, cross country. We're seeing stress fractures, shin splints.
And what are those? What's a stress fracture? That's not a broken leg.
It is a broken leg, but it's not the ones that you see that we all think of where the leg's just dangling out. It's basically it's an overuse injury that creates a small crack that you can't see on X-ray, creates a lot of pain with running, creates a lot of pain after running. Every step it can be painful. It's usually in the legs, down in the lower legs, just above the ankles. Very tender, sometimes going up and down steps. And we see that it's just a lot of it's overuse. So that's basically a stress fracture. We could get into more of it, but it's
And you had mentioned concussions.
concussion. Yeah.
Because we see it in professional athletes. Concussion is a pretty serious head injury, right?
Yes.
But you don't see blood.
Yes. I tell my athletes and I tell my coaches and I tell my parents, this is the first medical injury that we now have a state law covering. So there is actually a state law through the state of Ohio and other laws throughout in other states covering concussion care. So that's how serious of an injury that this is. Everyone thinks that it's not that bad of a deal. 20, 25 years ago when I played, they blew them off. The only time you'd ever get attention is if you were completely knocked out, you were out cold, you didn't know where you're at. Well, now we're seeing kids with a lot of headaches, dizziness, difficulty at school, functioning, just everyday activities, even looking at bright light, loud noises causes headaches and just a lot of symptoms. They get very tired, fatigued, and it's a very serious entity. And not only is it just in high school, but middle school, in our Pee Wee football leagues, soccer leagues.
Even that young.
Yes.
And it can happen at practice, during a game, anytime.
Anytime someone hits their head or jars their head, it doesn't have to be a head-to-head blow that you see in football. It can be a head-to-ground contact.
Sort of like Josh McCown from the Cleveland Browns. First game, hits his head in the end zone, and he's out for 2 games.
Correct, yep. And so there are specific signs and symptoms that we follow. Coaches now are mandated to take concussion courses through the state of Ohio. So whether you're a Pee Wee football coach, a soccer coach, or a high school coach, or even a collegiate coach. So Urban Meyer probably had to take the concussion course. So all the coaches are mandated in the state of Ohio, whether you're collegiate level all the way down to Pee Wee, that you have to take these classes.
And do most of your patients understand that, or does that take a little coaxing?
Well, the biggest thing that we've been trying to do is educate people. We're trying to educate the parents, we're trying to educate coaches, and we're trying to educate the kids on what to look for if they were to sustain a blow to the head. If they're having problems in school, they're trying to concentrate, they're having headaches, they're had dizziness, unsteadiness.
Yeah, but they just want to play.
Yeah. Well, the thing is you have to understand that you only have one brain, and you need that brain for the rest of your life. And if you've watched and been very observant over the last several years, there's been a lot of media. Junior Seau is a prime example. There's a condition called chronic traumatic encephalopathy, and they're thinking that that is a very serious brain injury that causes degeneration, which therefore causes symptoms of depression and suicidal thoughts, and these guys are dying because of it. And
So it's really serious.
yeah, and it's because of repeated blows to the brain. A prime example is look at boxers. A lot of these boxers have a lot of dysfunction later in life, and the same thing we're finding now is in football. And so it's becoming a serious injury. And
Now, football players wear helmets, but soccer players don't.
correct. And whether you wear a helmet or not, irregardless, whether you take a blow to the brain, again, whether it's head on head or if you fall and hit your head on the ground, or even just like a whiplashing type maneuver, can still create a concussion. It's the brain moving around inside the skull that creates the concussion. And so a helmet is not going to fully protect you. And that's a falsehood that a lot of coaches are, well, he's got this new concussion helmet. Well, there's no such thing as a concussion-proof helmet. So
So pay attention to your doctor. Pay attention to yourself and your own symptoms, and don't ignore that.
exactly. And that's and the coaches, if you think that your athlete has sustained a concussion, pull them out. So we always say, when in doubt, pull them out, get them evaluated, get them seen. There are new testing that we're coming out with right now. Finally, in Tuscarawas County, all of the schools that we take care of here at Union, we're implementing the Cog State Sports Neuropsych test that's a computer-based test. Up in Stark County, we used Impact Neuropsych test out of the Pittsburgh UPMC. but now we finally have that down here with all of our schools. So that is a piece of the puzzle that helps us evaluate kids with concussions. And so when we see them here in the office, they go through multiple tests, multiple memorization tests, physical examination with cranial nerves. We evaluate, talk to mom and dad how things are going. And the biggest thing that we do is we get them school accommodations, because you can't go to school having severe headaches, dizziness, because you're not going to make it. So sometimes we keep kids out of school. We put them through certain academic accommodations. We spell that out for them. As their concussion symptoms improve, we lift those, and then we get them back to their sport.
So everyone's involved, from family to schools to work or whatever you need.
Yeah.
All good advice to have, and pay attention if you feel that there is any indication of a concussion.
Correct.
Well, our sports medicine specialist here at East Ohio Orthopedics is Dr. Jim Goff. Thanks for being on Medical Minutes.
Thank you for having me.
Searching for quality bottled water? Call Crystal Springs Water Company. Crystal Springs Water is a family-owned and operated company that's been proudly serving the community since 1986. Crystal Springs offers a quality bottled water in a variety of sizes to suit your everyday needs. They also carry a selection of water coolers, cups, bottle racks, hydro pumps, and premium water softening salts. All available for pickup or delivery. Call Crystal Springs Water Company today.
Hi, I'm TV2 Sports Talk's Bill Morgan. Some people are outstanding at playing sports, and then there's me. While we at TV2 Sports Talk may have never been All-State on the field, we are Tuscarawas County's MVP when it comes to local television sports talk and play-by-play. Catch TV2 Sports Talk Wednesday nights at 7 and Friday afternoons at 5 on DMG Channel 2.
Welcome back to Medical Minutes here on Time Warner Cable DMG TV2. This time around we have Dr. Will Burgett. We are still at East Ohio Orthopedics. And Dr. Burgett, tell us about what you do as an orthopedist.
As an orthopedic surgeon, I treat musculoskeletal problems of the bones and joints. I have a particular interest in joint replacement and joint reconstruction of the hip and knee.
So that does require, obviously, surgery.
Yes, it does require surgery, yeah.
Now, when we're talking about hip replacements, how common is that? You hear about knee replacements all the time.
Yep, hip replacements are very common, just as common as knee replacements. Usually it's a chronic problem that people have been dealing with for a while. Can be precipitated by injuries as well, but they are fairly common.
And what makes you want to replace the whole hip?
It's pain. Pain usually is the precipitating factor that leads people to have their joint replaced. That's really what we're going after when we do joint replacements.
Because they just can't take it anymore.
Right, exactly. It's really a quality of life issue to where their quality of life is unacceptable to them currently and leads them to having the joint replacement.
And what's involved in a hip replacement? Is it a piece of metal? Does it actually look like a hip? What's involved?
Yep, there's actually a couple pieces to it. You start, there's the femoral side that has a ball part, and then the socket part is your acetabulum. And we do replace both of those. So we take out the native ball, and then we replace that with a little stem on it that goes into the femur, and then we also replace the socket side as well. So there's metal on both sides of the joint, and usually there's another bearing surface in there that they articulate on.
Now, when I think of a hip, though, I think of, the pelvic outside. You don't replace that part.
Nope, it's just the ball and socket portion of the hip that we're replacing. Yep.
And how old are your patients? Are they all elderly?
The patient population is becoming younger as we go with hip replacements or patients becoming younger. Traditionally, joint replacements are reserved for the older patients who are debilitated quite a bit and are unable to walk. Or patients are becoming younger and they're, have higher functional demands with hip replacements. So we do have younger patients as well.
I'm thinking maybe, some kind of injury where they fallen or they were, I don't know, in a car wreck, or what does that?
Arthritis is usually, it's a chronic problem that develops over years. It can be precipitated by an injury. Patient has a fracture around their hip, can lead to later arthritis that leads to a joint replacement. But a lot of people, it's either wear and tear or just the way that they were born.
And how long does a hip replacement last? Do you need to turn it in for a newer model?
It's a good question. The short answer is we're not sure, because the implants we're putting in now obviously haven't been around that long. But the implants that were put in 15 years ago, 90% of them are in and functioning still, and the materials that we have nowadays are much better. So we're hoping we have 30-plus year joint replacements. And
depending on your age, that could be your lifetime.
Yep, could be a lifetime, and there's a lot of factors that go into that. Patient factors as well. I make the analogy to my patients quite frequently. It's like buying a new car. Some cars run to 300,000, some run to 100,000. Depends on how you drive it. It's a lot of it too. So you can wear out a joint replacement.
And typically, if you replace one hip, do you have to replace the other joint too?
Not necessarily. You see frequently that we do replace both, but there are plenty of people that just have arthritis in one hip. So,
any way to prevent that? Yeah, so I don't have to have a hip replacement.
Yeah, it's there are a lot of factors that go into development of arthritis too. Some of it's wear and tear, high impact activities. So if you're starting down,
I thought that was good for you.
Yeah, it is, but higher impact activities, running, and a lot of that sort of thing, especially when you've already started down the path of arthritis, can definitely cause it to progress faster.
Is there any way to avoid the surgery?
It's a quality of life issue. It's not life and death. So if it's really about how much pain you're having and how much you're willing to deal with it. So I tell my patients also that you never have to have your joint replaced, but if your quality of life is that bad and you're having that much pain, I tell them this can get them back to their activity level to do the things they need and want to be doing. So.
And how did you get interested in all this?
Started with orthopedics. I had my own experiences with my shoulder and got me exposed to orthopedics, and then I started seeing some total joint patients come back into the office afterwards, and they're very grateful and very happy that they have their quality of life back, and it's very gratifying for me to see those patients that you're able to give them back that quality of life.
And where'd you go to school?
Well, I went to medical school in Erie, Pennsylvania, and then I did my residency training in Cleveland out of South Point Hospital in the Cleveland Clinic Health System. And then I was in Buffalo this previous year doing a total joint fellowship, specializing in hip and knee reconstruction. So doing primary total joint replacement, but also complex revision joint replacement.
And what brings you to Tuscarawas County?
Well, I have family ties to the area. My wife grew up in New Philadelphia, and her father was a family physician in the area. So that was my initial exposure. But once I, came to the area, met the people, I'm a community guy, and after being in the academic setting for the last 6 years, I'm very happy being back in the community setting. So it's the people, I think. So.
Fantastic. Well, Dr. Will Burgett, he is an orthopedic surgeon here with East Ohio Orthopedics in Dover. Thanks for being on Medical Minutes.
Well, I woke up to the sound of silence and cars. We're cutting like knives in a fist fight. And I found you with a tear in your eye, your head in the curtains and heart like the 4th of July.
You swore and said, we are not shining stars. This I know. I never said we are. If you're lost and alone, or you're sinking like a stone,
My name is Danielle. I'm a 2000 graduate from Buckeye Career Center Health Occupation Program, which helped me get my job here at Union Hospital on the pediatric floor as a registered nurse.
We are Buckeye Career Center graduates.
Buckeye Career Center helped my family get the training and education they needed to start our careers.
We're Buckeye Career Center graduates.
I'm Rod. Upon graduation at Buckeye Career Center, they helped me find a job.
Adults who return to Buckeye Career Center to continue their education usually have one goal in mind. They want the opportunity for a better job. The fact is, adult education programs at Buckeye Career Center are less expensive and provide greater opportunities for job placement following graduation. It's your future. Get the facts. Buckeye Career Center. We put people to work. Find out more about your future at buckeyecareercenter.org.
Welcome back to Medical Minutes. We are at Union Hospital for this segment. We are talking with Dr. Nate Johnson. He is an emergency room physician. And we're also going to talk with Andy Dominic. She is the director of the Alcohol and Addiction Center at the Tuscarawas County Health Department. Now, Dr. Johnson, we're going to start with you. As we are in this room and we have just heard from several people talking about State Issue 3. But what I'd like to do is concentrate on what happens in an emergency room. What do you see as far as when patients show up and they're on drugs? What are they typically on?
Probably the more commonly abused drugs now that we see. Obviously, heroin's a big issue, and that's probably the most imminently or acutely life-threatening of the drug overdoses. Other than that, cocaine oftentimes, and we'll see cocaine present as a heart attack. Heroin usually presents as an overdose. Somebody's just not responsive, not breathing, may or may not have a pulse. And then marijuana, because of its how widespread it is, we see that, and typically the acute intoxication or overdose on that is confusion, changes in mental status, but oftentimes it's more vomiting, sometimes again lethargy, but vomiting, abdominal pain, psychiatric complaints, hallucinations, those are not uncommon with that as well. And then when it happens with a child, oftentimes it is more of that lethargy, not responding, difficulty breathing, certainly vomiting and abdominal pain with those as well.
And how much of a drug do they need to end up in an emergency room?
Well,
the first hit will do it?
It's difficult to say. Rarely would probably a one-time dose of smoking marijuana actually lead to an emergency room visit. And in fact, smoking itself rarely leads to any type of emergency room visit, at least acutely, because if you're smoking, you probably understand how to use it. It's the edibles, the form that people ingest, those are the more likely ones. And it's really difficult to decipher a dose because it's a natural product. It's not a pharmaceutical grade. So one gummy bear in one bag might have twice the content of another. So it's just difficult to say. Plus, ingestion times, or I should say absorption times, vary. So it's really difficult to say. Most of the time, people just know that they had some marijuana edibles. They don't know exactly how much.
Now, often in the media, you will hear a lot about methamphetamines and how people are cooking them in, a 2-liter bottle of pop, and it's really, really dangerous. Do you see people in the emergency room with that too?
From methamphetamines, yes, because the chemicals used in producing that are quite toxic. There are oftentimes explosions or fires related to those, the meth labs, and then just fumes. A lot of times people make those things in their car because there are some forms of those you can make without an open flame. So yeah, the chemical exposure to those is pretty awful, and in fact, if you look at the law enforcement folks who have to clean those labs up, they go in basically Teflon suits to clean those up. They're like a super fun sight for the EPA, really, once they get done there.
And as an emergency room physician, you really, I'm assuming that you would really prefer people not to use drugs at all unless they're by prescription.
It would certainly help my day.
There are over-the-counter medications, though.
You mean over-the-counter medications that can be abused as well?
Yes.
Oh, certainly. I mean, this is the problem that we see today, is that any medication poses some abuse potential, and certainly it can have toxicity when misused. So yeah, unfortunately, there's no shortage of the ingenuity people can have when they're trying to get a buzz or trying to get some type of chemical high. I have no doubt that in a couple years, some completely innocuous medication over the counter is going to be misused terribly, and kids are going to get sick from it.
And once they're treated in the emergency room, they may end up with the Alcohol and Addiction Center. Now, Andrea, tell me about what kind of patients you see.
We see a varying level of patients, someone who may have just gotten into drugs, experimenting with them, all the way to the full-blown addict, and some near death because of their addiction.
And is it what many people might consider, they slowly get into drug abuse, or do they dive right into the really hard stuff?
Typically it's a slow onset, and they don't realize what's happening when they start experimenting with alcohol or marijuana, because our society says alcohol is a rite of passage, and our society is also saying marijuana is very safe. So then when there's risk factors in an individual who are already at a higher rate to be an addict, and then they're introduced to those substances, it's almost an automatic effect of addiction.
And how long does that take to get them off of these drugs?
Oh, wow. First of all, they have to be willing and wanting to. So for some people, they can go in and out of treatment 5-6 times until they really get it. But as long as you're planting that seed and trying to deal with acute crises at the moment, it can happen.
And they go through maybe one treatment session or try and get off and end up right back in their cycle of addiction.
Most definitely. If you look at Steven Tyler from Aerosmith, he's a great example. He was a cocaine addict and alcoholic. He went to rehab, got off of those, then he had to have foot surgery to repair his broken bones in his feet from all the antics that he did on stage, and then became addicted to opiates. So he is now fully in recovery, but he had to go through treatment several times for different drugs, which is not uncommon either.
And what kind of patients do you see in Tuscarawas County?
Most of the people that we see in Tuscarawas County start off with alcohol and marijuana. I'm blown away with the amount of people who use alcohol and marijuana regularly, and they're in that resistive stage where they don't want to let go of that drug because they feel they're normal when they're using.
And then do they, what I think, a harder drug, like you said, the opiates, do they move on, or do they recognize that I need to cut back?
Yeah, most people do move on because they're trying to fill a very big hungry ghost inside of themselves, and typically the harder drugs, cocaine, methamphetamines, heroin, do a great job at numbing and putting to sleep, your rational intelligence and things of that nature. So yes.
So as we talk about all of these things, one underlying, when you go to the emergency room or you go seek treatment for addiction, is money. People that are addicted come from all economic backgrounds, but it is expensive to treat it no matter where you go.
Most definitely. Thankfully, we do use a sliding fee scale at the health department, but still it costs a lot of money for treatment. They say for every $1 spent on treatment, $7 is saved in healthcare costs. So treatment is a great investment.
All right, very good. Andrea Dominic, she is the director of the Alcohol and Addiction Center at the Tuscarawas County Health Department, along with Dr. Nate Johnson from the emergency room here at Union Hospital. Thanks for joining us on Medical Minutes.